Now let's review the bones of the forearm, which are the radius and the ulna. The radius and the ulna are in your lower arm. On the medial side, so your pinky side, is the ulnar bone, and on the lateral side, which is your thumb side, is the radius. So we have an anterior view and a posterior view of these bones, and let's go through the features. First is we have the olecranon process, which goes into the olecranon fossa of the humerus. We have the trochlear notch, which goes around the trochlea of the humerus. And it's really good if you can see this on the skeleton, how the articulation works. And then we have the coronoid process, which is kind of completes that semicircle of the olecranon process, the trochlear notch, and the coronoid process, which rotates about the trochlea of the humerus. We have the radial notch, and that is where the radial head articulates with the ulna. And all four of these so far are on the ulna bone. We also have the ulnar tuberosity, which is anterior. And we have the ulnar head, which is distal. And the ulnar styloid, which is the little bit of bone that sticks out. We also have the antebrachial interosseous membrane, and that is a membrane that goes between these two bones, which kind of keeps them together. All right, so let's look at the radius. We have the radial head, which articulates with the ulna and this forms the radial ulnar joint between the radius and the ulnar. We have the radial tuberosity, which is anterior on the radius. We also have a styloid process, which you can articulate or palpate. You have the ulnar notch, which is where the head of the ulna articulates at the distal portion of the radial ulnar joint.